Okay, I just have to say got it, and that should approve it.
Yeah.
So,
okay.
So, Kidge,
Yeah.
what made you want to write this book?
Well, I didn't know that I wanted to write it because I was asked to write it by the publishers, rather like my first book, Focus on Solutions, which was similar. And what I did know, though, was that I didn't want to write it on my own. So I was delighted when Sarah Northcotts agreed to write it with me. So it's very much co-authored by myself and Sarah. And then, you know, once we sort of got going, we started to think about how we wanted to talk about recent developments in solution-focused brief therapy, and then also the kind of more recent work that we've done, because Focus on Solutions, I wrote what it was published in 2005 and then updated in 2016. So, you know, there's a lot of stuff that that I've been doing over that time, in fact, since 1997, that I felt that would be of interest to others. So that's really how it all started.
So, what were your best hopes in writing this book?
Well, I knew the Working With series. It's a nice series. It's the books are spiral bound, which I think is kind of very user friendly. It's a A4 format, which again I think is sort of slightly different. And my best hope, I think, was really in terms of the medical setting to hope that the kind of doctors, nurses, allied health professionals will incorporate even more of this into their everyday work. But more generally, I think we both wanted it to be a kind of accessible introduction to people who maybe hadn't encountered this way of working before, but at the same time of interest to people who you know, are familiar with it, and that it would have relevant bits of interest to them as well.
Anything else?
Well, I mean, we're both speech and language therapists by background, so obviously the case examples, which I think is sort of really key, were drawn a few from that setting. But I think although the title is Working with Solution-Focused Brief Therapy in Healthcare Settings, I think it was really hoping that, you know, we can all struggle with health conditions, and so really it's a kind of, again, relevant to all of us, and that best hopes can be similar whatever the context. You know, we're often talking about confidence, about wanting more energy, and this can be you know, subjects and conversations that come up in any workplace, in any settings, whether it's hospitals, schools, and with any age. So I think we really hoped that it would be something that would be relevant to as wide an audience as possible.
Right. So what would you say were the key things or key messages you wanted people to take away from this book?
I think this the current thinking on solution-focused practice, which I've already mentioned, and Sarah's done a fabulous first chapter on that, and being an academic, she's very good on talking about sort of qualitative and quantitative evidence base that is sort of developing in this field. I think you know, we felt that the detailed transcripts were very important as a learning process for all of us. So it's really about taking it through the different sort of recognizable headings, like, you know, desired outcome, future focus descriptions, past progress, and looking at that in the context of the first session and the follow-up sessions, which I think often don't get covered so much in some of the other books that are out there. And I think just for this chapter alone, Sarah has written about people with limited verbal communication, which is her speciality, and it's really amazing to see and look at the examples that she gives and how this approach again can be accessible to that client group.
Right. So you may have partly answered this, but what would you say makes your book different to the many other books written on solution focused practice?
I think, yes, some of the case examples given. There's another one. I mean, maybe if I refer to some of the feedback that's come through already. Somebody said they particularly enjoyed the Ronnie, we call him, is a gentleman with dementia. And again, I think some people think that maybe solution-focused practice wouldn't be accessible to some people with significant memory problems and cognitive problems. I think, again, it may be looking at solution-focused practice and how it can be integrated into other work roles often isn't discussed enough, because many of us have other jobs other than just doing counselling and in the therapy world. And I think, for example, a speech and language therapist, but any allied health professionals, again, doctors, nurses, advice giving is one of the things that we have to do. So we discuss how we can maybe do this advice giving in a more solution focused way. So that's, I think, one kind of aspect that I'm pleased that we managed to talk about. Reflections on this, on the interactions, I think is another bit of feedback we've got from people saying that they've enjoyed reading the transcripts, and then we follow up with these reflections of thinking how we maybe, explaining our thinking behind what happened and maybe how we could have done things differently. So that's a really important learning process, particularly for people new to the approach, I think. What else? Well, we do a very comprehensive list of questions with each chapter. We have a section on kind of mindset or stance, which some people prefer that word, but and how we can keep solution focused in these conversations. And we've also included quite a lot of exercises that people can do in groups or with themselves. So I think there's quite a lot in there. It's quite a comprehensive book, which I hope means that it's these books aren't cheap, but that I hope it's value for money at the end of the day.
Okay. What would you say you learned from writing this book?
The joy of writing with somebody else. It was just wonderful to be writing it with Sarah, because she's got such a sort of clear focus, and this sort of, she was very good at making sure that there was a sort of logical, coherent layout. Sometimes I can jump around a bit and I don't explain things enough, and I think she would question me and say, can you explain a bit more your thinking behind this? So that was very, very useful. And I think also, helping decide what to leave out, because there was a lot of material that we wanted to put in, and of course that wasn't possible to include everything.
So what challenges did you face when you were writing this book?
Well, kind of that thing of trying to kind of not make it too long, because it isn't always helpful to sort of put so many case examples, say that kind of once repeating the same point. I think we wanted to include a chapter on supervision and support, and so again that kind of added a bit to the length, but I think we're very pleased that we have included that. The series is, if you look at some of the other books, sorry, I've got a bit of a cough, as you can tell. They talk about treatment options, interventions, and of course those are phrases that don't lend themselves very well to solution-focused practice. So I think there was a bit of a challenge to make sure that we kept true to solution-focused brief therapy, to really focus on the person, not the diagnosis. And I hope we've been able to do that in a way that honours the solution-focused stance.
Is there another book in the wings?
I think no, not from me. I think 2 books from me is enough. But I think, watch this space. with the work that Sarah's doing, because she's doing ongoing research with people with limited verbal communication with aphasia, and it really is very important work. It's important in terms of evidence base for solution focused practice and in the greater world of aphasia. And I think that's the space to watch in terms of certainly in terms of me not supporting her in that, and what else we can learn from the development of solution focused practice in that area.
Okay. Well, they say that there's a book in all of us. What advice would you give to other solution focused practitioners who are considering writing a book?
I would say, if you have passion for the subject and you have dedication to put in all the hours that you need to write books, then go for it, and find people who give you encouragement. I think the solution focused world is a very encouraging place, supportive place. Both Sarah and I were very lucky because we were trained by Brief, and through their wonderful training and their encouragement over the years, we felt we were able and had the confidence to do this. So with thanks always to Brief.
Okay. Thank you very much, Kidge Burns.
Thank you, Ian. Thanks for your wonderful questions. They were great.
Okay. Are you still recording or have you switched it up? I think you click the stop button.